My name is Nicole Powell, and this is my patient, Mr. Powell, and today I'm going to do an assessment on the eyes, the nose, the mouth, the lungs, and the heart. First, I'm going to start with cranial nerve 2, which is the optic nerve. The Snellen test tests distant vision. The patient stands 20 feet away from a chart on the wall and reads from the very top line from left to right and works their way all the way to the smallest line that the patient can read. The results are recorded as a fraction. The numerator is the distance at which the patient is standing away from the chart, which is 20 feet, and the denominator is the number at which a patient with normal vision can read the smallest line. The next test is the Rosenbaum test, which is kind of the same concept, except the patient holds the chart away from their face at 14 inches and reads from the top to the smallest line, left to right. For both the Snellen test and the Rosenbaum test, the patient covers one eye, and then they do it with the other eye, and then they do it with both their eyes. The Rosenbaum test results are recorded as a fraction, the same concept as the Snellen test. The first vision test I'm going to do is the peripheral vision test. So I'm going to have my patient turn to me. And I'm going to have my patient hold this, put it in front of one eye. And I'm going to move my pen from outward to inward, and the patient's going to tell me when they see it come into their line of vision. So tell me when you see the pen.
Yes.
And then we're going to do it with the other eye.
Yes.
Okay. And then the next nerve we're going to test is cranial nerve 3, the ocular motor, cranial nerve 4, the trochlear, and cranial nerve 6, the abducens. We're going to do the 6 cardinal signs of gaze. So what I'm going to do is I just want you to look at the tip of my pen, and don't move your head, just move your eyes into the direction that it's going. And I'm making an H pattern. Okay. And now I'm going to test the corneal light reflex with my pen light. And I'm going to look for the twinkle in the eye. Okay? Now I'm going to do the cover-uncover test. So I'm going to have the patient just look right here at the tip of my pen, and I'm going to cover each eye, and then I'm just going to pull the piece of paper away and just make sure that the patient is still able to focus on the pen. And then I'm going to do it with the opposite eye. Okay. The next thing I'm going to do is inspect the eyebrows, the eyelashes, and the palpebral fissures, which is the space between the upper eyelid and the lower eyelid. And I'm going to note any lid lag, and I'm going to make sure that they're symmetrical. And then I'm going to inspect the external ocular structures, which is the lens, the cornea, the iris, the sclera, the lacrimal apparatus, conjunctiva, anterior chamber, and position of the globe. So the next thing I'm going to do is inspect the pupil for the response to light, direct, and consensual. And the pupils do constrict with light. I'm going to palpate the lacrimal sac, which is right here in the inner eye area. Now I'm going to test convergence and constriction. Okay, I want you to focus on the point of this pen, and I'm going to move it towards your nose. And I want you to just, don't move your head, just focus with your eyes. Okay. Next is cranial nerve 2, the optic nerve, doing an ophthalmic exam. I'm going to use my ophthalmoscope. I don't have a real one, so I have a little toy one that I got from Toys R Us. I'm going to assess the inner eye. And I'm going to inspect lens clarity. And I'm going to inspect the optic disc. And I'm going to also inspect retinal vessels. I'm going to note the color, the width, the number of them, and if there's any crossing. And then I'm going to inspect the retinal background for any exudates, presence of hemorrhages. And then the last thing I'm going to look at when I do the ophthalmic exam is look at the macula and the fovea centralis for color and regularity. You can turn towards the front. So he's going to move towards the front. I'm just going to scan the room. Okay, next we're going to assess the nose. I'm going to inspect the size, the shape, and the symmetry. And then I'm going to take my little tool. Also, I got this from Toys R Us, so it's not real. And I'm going to inspect the septum, the mucosa, and the terminates. I'm not really going to put it in his nose because it will hurt. I'm going to assess for patency, so I'm going to press on your nostril, and I just want you to breathe in. And do it on the other side. And then I'm going to test cranial nerve 1, which is the olfactory nerve. And I'm going to have the patient close his eyes, and I'm going to have him smell something, and he's going to tell me what it is. So close your eyes and tell me what this is. You can smell.
Cinnamon.
Cinnamon. Okay. One more. Smell.
Alcohol white.
Alcohol white. Good. Now we're going to move on to the mouth and the pharynx. I'm going to look at his teeth, his gums, the mucosa in the sublingual area, and the lips. I'm going to inspect the frenulum, so lift up your tongue for me, right there. And then we're going to inspect the Wharton's and Stinson's ducts. The Wharton's duct is underneath the tongue. Underneath the tongue. And the Stinson's duct is over on the side of the mouth. And then I'm going to check for rise and fall of the uvula. I mean, not the uvula, the hard and soft palate when the patient says ah. So say, I gotta touch your tongue. Say ah.
Ah.
Okay, and then the uvula is also midline. Cranial nerve 9, the glossopharyngeal, and cranial nerve 10, the vagus. Also test for speaking, swallowing, and the gag reflex. I'm going to then finally just assess cranial nerve 12, which is the hypoglossal nerve, and have the patient move his tongue back and forth, up and down. So move your tongue. Okay, good. Now we're going to assess the lungs. First, I'm going to inspect the anterior chest for color, symmetry, and I'm going to note the diameter and the chest expansion when he breathes. I'm going to check for thoracic expansion, so breathe. And make sure that it's equal. I'm going to palpate for tactile fremitus. Well, first I'm going to palpate for bulges, mashes, lesions, and any tenderness that he may have. So just tell me if it hurts. Sorry, it tickles. And now I'm going to palpate for tactile fremitus. So I'm going to put my fingertips right here on the patient. And I'm just going to go over several areas, and the patient's going to say 99. So say 99.
99. 99. 99. 99. 99. 99. 99.
Okay. I'm going to auscultate both the anterior and posterior. So take a deep breath. Okay. And that's it. So the next part, I'm going to do cardio. I'm going to inspect the chest for heaves, thrusts, and lifts. I'm going to palpate the anterior chest for the PMI, which is right here at the fifth left intercostal space. And then I'm going to listen to the heart sounds. So I'm going to first start with the aortic area, and that makes an S2, S1 sound. Then I'm going to move to the pulmonic area, which makes an S2, S1 sound. Erb's point, S1, S2. Tricuspid area, S1, S2. And the apical, S1, S2. Then I'm just going to palpate the different pulses. The only one I'm not going to do with him is the popliteal behind the knee because he's really ticklish. So we're going to start with the temporal, the brachial, the radial, the popliteal, which is behind the knee, the dorsalis pedis, and the posterior tibial, which is basically the inner ankle. Okay. And the last part I'm going to go over is the hearing, which I have to get a tuning fork. I don't have a real tuning fork, so we're just going to use a real fork. So cranial nerve 8 is the acoustic nerve. The first thing I'm going to do is inspect the auricle, turn your head this way, right here, and the mastoid area. I'm going to inspect the external meatus and the ear canal. To look in the ear canal, I'm going to pull the pinna up and back and look for any drainage. And then I'm going to inspect the tympanic membrane. And it should have a cone shadow. I think I got everything on that one. And then I'm going to perform the whisper test. So I'm just going to whisper something to the patient in this ear and then the other ear, and he's going to repeat it. C-L-E-M-S-O-N.
C-L-E-M-S-O-N.
No, you have to say it.
C-L-E-M-S-O-N.
T-I-G-E-R-S.
T-I-G-E-R-S.
Now the next test I'm going to do is the Weber test, which is with my tuning fork. And this test tests bone conduction. So I'm going to tap the fork on the palm of my hand, and then I'm going to put the base of it on the top of the skull midline, and the patient's going to tell me if he can hear the sound equally in both ears. Can you hear the sound equally in both ears?
Yes.
Yes. And then the next test is the Rhine test, and that tests both air conduction and bone conduction. Air conduction is greater than bone conduction by 2 to 1, so normal air conduction is 30 seconds, and then the bone conduction is 15 seconds. So I'm going to tap the tuning fork on the palm of my hand and put the base of it right here in the mastoid area. And typically the patient will it'll take him about 30 seconds to tell me that he doesn't hear the sound anymore. Okay, it's been 30 seconds. Do you hear it anymore? No. And then I'm going to put the other side right here in the front of his ear. And that sound will take about 15 seconds for him to no longer hear. And that's the Rhine test, and I would do it in both ears. And I think we're done.